Men, can I level with you? If you've been brushing off night sweats, a little weight loss, or heavy fatigue as just stress, you're exactly who I'm talking to. I'm Dr. Jame. Early HIV signs often look like everyday life. That's why guys miss them. Here's the reality. Biology tilts the risk. Per 1,000 exposures with a detectable partner, receptive vaginal sex, 0.8 infections. Insertive, 2.4. Women face more exposure per act. Men get diagnosed more often because we delay testing. These are CDC and NIH estimates. In the US last year, men were over 80% of new diagnoses. Out of 1,000 cases, 800 plus were male. That's not a scare line. It's a call to clarity. I'll map 10 early signs and the steps to take now, so you can move from worry to control. Mini hook. If 2 of these 10 sound familiar, don't panic, but don't dismiss them. Keep watching at the solutions section. I'll teach my 60-second rule to separate imagined danger from real risk at home. If this helps, please subscribe and comment 1 so I know what to clarify first. As your physician, let me start with a paradox. The group biologically more at risk isn't men. Yet men end up diagnosed later and suffer heavier consequences. Biology speaks first. The female genital mucosa has a larger exposed surface and thinner protective tissue, giving HIV more entry points during intercourse. But culture causes the real delay. Many men default to "I'm fine," avoid uncomfortable talks, and skip testing after risky encounters. Stigma adds pressure. Fear of judgment from partners, friends, or even doctors keeps them waiting instead of checking early. Here in the US, I see this every week. Men aged 20 to 35 report higher sexual activity but fewer routine screens and follow-ups. So, while women may acquire infection more easily per exposure, men are the ones diagnosed late, sometimes when their immune system is already struggling. A late diagnosis means higher viral load, more complications, and lost chances for early treatment, partner protection, and peace of mind. Remember, biology sets the stage, but behavior writes the script. Testing habits, honest communication, and prompt medical care decide how the story ends. Your takeaway is simple. If exposure is possible, schedule your test by timeline, not by fear or convenience. A higher risk doesn't mean early detection. The real paradox lies in men. My goal is clarity, not alarm. Timely knowledge keeps both you and your partner safe. Guys, I'll be honest as your doctor. I hate what this disease does to men, couples, and families. That is why you need these definitions clear. You never have to meet me in crisis. HIV is not AIDS. HIV is a slow infiltrator that enters your body's defenses and chips away at immune coordination. AIDS is the consequence that appears when immunity collapses and opportunistic infections attack. Think of your body as an army. HIV is the saboteur in uniform, slipping past the gate, cutting radios, and opening doors from the inside. You may feel okay for months or years, even while damage accumulates silently. Here is the empowering part. When you recognize risk early and test on schedule, treatment suppresses the virus, restores immune strength, and protects partners. Millions live full American lives because they acted early instead of waiting for trouble. Your 3 anchors are simple. Know the difference, respect the timeline, and act before symptoms define you. Knowledge reduces fear. Timely care prevents progression. Honest conversations keep relationships safe. If these definitions are crystal now, drop an OK in the comments to show you're with me. I'm here to keep you informed, calm, and in control today. You've heard theory for 2 minutes. The next 60 seconds are hard numbers and real. Globally, about 40.8 million people were living with HIV in 2024, and roughly 53% were women and girls, according to UNAIDS. Unaid.org. That isn't background noise, it's today's baseline. In the United States, HIV is uneven. The South carries the highest rates, and states like Florida, Texas, California, and New York contribute large shares. The latest national count shows over 39,000 new diagnoses in 2023, and more than 80% were men. Those are the newest finalized CDC figures. 2025 surveillance pages still show men as the clear majority. Translation: women may be biologically more susceptible per exposure, but American men are diagnosed more often later, because screening lags. Here's how to read the scoreboard in plain English. Global burden remains to $40 million. About half of new infections worldwide involve women and girls. UNAIDS.org. U.S. diagnoses are concentrated regionally, and men make up the majority of new cases. Numbers are people, families, and futures. Remember that. If this data hits home, subscribe and comment TEST so I can tailor a quick screening guide for you next. If you fall into the low screening group, the next section is for you. As your physician, let me be direct. The most dangerous signs are the ones you're tempted to explain away. If symptoms appear after a sexual exposure, treat them as data, not drama, and follow the testing timeline I'll outline for you. Stage 1. Acute infection, usually 2 to 4 weeks after exposure. Expect flu-like illness, fever, sore throat, swollen nodes, headache, body aches, profound fatigue, sometimes a rash. Viral load is extremely high, which means you are most contagious even if you feel just a little off. Stage 2. Latent or chronic infection, the quiet decade. The immune system fights and adapts. Symptoms fade, life feels normal. The virus keeps replicating at low levels, silently reducing CD4 reserves. You can transmit HIV during this period, especially if untreated or inconsistently treated. Stage 3. AIDS, when CD4 drops below 200 cells, MM3, or opportunistic infections appear. Red flags include severe weight loss, persistent diarrhea, night sweats, recurrent fevers, chronic cough, thrush, shingles, mouth ulcers, and unusual skin lesions. Without treatment, complications escalate and hospital care becomes common. How to read your body like a clinician. Time the onset, document exposures, and don't self-diagnose. If you develop acute phase symptoms 2 to 4 weeks after exposure, test promptly and repeat by guideline intervals. If you feel fine but had risk, schedule screening anyway and protect partners. Even mild, short-lived symptoms deserve attention after risk. Combine common sense with evidence, not fear, and follow through on testing promptly. The stage when you feel normal can be the riskiest for the community. Gentlemen, welcome to the roll call of red flags. As your physician, I want you to scan this list like a pilot before takeoff, calm and methodical. If any item fits your recent reality, mark it and keep moving. Persistent fatigue with no clear cause. The kind that sleep doesn't fix and creeps into workouts, focus, and mood. Unintentional weight loss. Pants looser, belt tighter, appetite unchanged, or food tasting off. Recurrent fevers or night sweats. Not a single sweaty night, but cycles that soak shirts or sheets. Swollen lymph nodes in the neck, armpits, or groin. Tender or rubbery marbles that linger for days to weeks. Rashes or unusual skin changes. Fine pink macules, hive-like patches, or unexplained breakouts that come and go. Mouth ulcers or white patches. Canker-like sores, thrush, or burning that makes coffee or citrus uncomfortable. Sore throat that hangs on, not strep-level misery, just a stubborn, scratchy persistence. Prolonged diarrhea. Loose stools for more than a week, especially with cramps or urgency. Vague muscle or joint aches. A traveling soreness you can't pin on training, sleep, or workload. Reduced libido or suspected low testosterone. New disinterest, softer morning erections, lower drive without a clear stressor. How to read this clinically, the way I do in clinic. If you check 2 or more signs and had a recent risk exposure, book testing on the Testing 101 timeline rather than waiting for certainty. If your risk was months ago and you feel well, schedule screening anyway and protect partners while you confirm. Use a notebook or your phone to track dates, intensity, and any medications. Patterns matter. They separate coincidence from signal. And remember, many common illnesses mimic these signs, which is exactly why we use time-based testing instead of fear-based guessing. 2 small signs that seem trivial can be the earliest unlock. Said differently for my US audience. 2 small clues can unlock early clarity. For you right now. Act with steadiness, not panic. Hydrate, rest, and avoid alcohol binges while you plan your next step. Most important, set a reminder to follow through on testing and follow up, even if symptoms fade in a few days. One young man told me this in my clinic. "Doc, I thought it would go away." That sentence captures why men delay. We minimize symptoms, hope for luck, and avoid the awkward conversation. We also fear judgment, not just from partners but from co-workers and even clinicians. So we wait, bargain with ourselves, and lose the most valuable asset in medicine: time. Another driver is confusion about the window period. You can carry HIV after an exposure, but if you test too early, your result can be falsely negative. The virus is present, the markers are not yet measurable, and the clock matters more than confidence. Here is the simple frame I teach. If exposure occurred, use time-based testing, not anxiety-based guessing. Plan an early option when appropriate, then repeat at the guideline intervals until you are truly negative. CTA number 2. If this sounds exactly like your story, comment "I choose clarity," and I'll prioritize a men's Q&A video with step-by-step timelines. This is not about blame. It is about protecting your future and your partner with calm, orderly action. Schedule, test, and follow through, even if symptoms fade. Clarity is not a feeling. It is a plan on your calendar. Private testing is confidential, respectful, and faster than anxiety. Book today and breathe with certainty. Men, I don't blame you when this happens. As your doctor, I've sat across from hundreds of guys who walk in with fear and leave with a plan. In every face, I see the same word twice: hope and more hope. Here is what's emerging in the labs and early trials. AGT103T is a personalized gene therapy that trains your own T cells to fight smarter, aiming to resist HIV without daily pills. Some participants pause standard ART under supervision to test whether their edited cells can hold the line. On the vaccine front, candidates like GeoVax are designed to sharpen immune recognition, so the body spots HIV earlier and responds with targeted force. These strategies point toward a functional cure, meaning control without continuous medication if strict clinical criteria are met. Think of it as dimming the virus until it can't move the needle on your life. The key may not be erasing the virus, but making it powerless. Trials take time, safety comes first, and no one should stop therapy outside a study. Still, this is why I see hope in every man I treat. Science is building exits, and your job is to stay in the fight. Most men think only big mistakes create big problems. Yet body chemistry can tilt outcomes long before a crisis. As your physician, here is how hormones and habits feed or starve viral momentum. Testosterone is powerful. It fuels energy and libido, but it can intensify inflammatory signaling when stress piles up, sleep runs short, or alcohol becomes routine. A hotter baseline lets viruses exploit chaos and slows recovery after minor illnesses. Women often mount steadier immune responses. Men surge early, then fizzle when lifestyle keeps the system on constant alert. That is why recovery pillars matter more than bravado. My clinical checklist is simple. Sleep 7 to 8 hours. Limit drinking and hydrate. Protect skin and mucosa with gentle hygiene and appropriate lube. Pair training with rest days. If this hits home, tap like. Your support helps me keep building education. Remember, the strongest move isn't grinding harder, it's knowing when to rest, when to test, when to ask for help. Strength is restraint and smart timing. Take 60 seconds with me and write these 3 tools down. They're the backbone of clarity, the difference between panic and precision. 1. Antigen antibody test. This is the most common lab test using blood from your vein. It can usually detect HIV between 18 and 45 days after exposure. If done by finger prick, the window widens to 18 to 90 days. It looks for both the virus's protein, antigen, and your body's response, antibody. It's accurate, but you must respect the timeline. Testing too soon can fool you with a false negative. 2. Rapid test. At home or in a clinic, results come in about 30 minutes. It checks for antibodies in a single drop of blood or oral fluid. If it's positive, you must confirm with a lab-based test. If it's negative, but exposure was recent, retest at the next interval. 3. NAT, PCR, RNA test. This one searches directly for the virus itself. It detects infection as early as 10 to 33 days after exposure and is used when you need an early, definite answer. It's more expensive but highly sensitive. Follow the testing schedule. Around 3-4 weeks, then 6 weeks, then 3 months depending on test type and risk. Write those dates down today. That's your health map. A negative result too early doesn't mean real safety. Understanding the timing does. True safety is knowledge, not just numbers. We've entered a new era, and I want every man listening to hear this clearly. When you act early, stay consistent, and use the right tools, life goes on. Strong, normal, and full. Modern ART, or antiretroviral therapy, restores immune strength, keeps viral load undetectable, and lets you live, work, love, and dream without fear. I have patients who've built families, careers, and long healthy decades simply because they stayed in care. Here's the cornerstone principle. U, undetectable equals untransmittable. When the virus is suppressed below detection, it cannot be passed through sexual contact. That's not wishful thinking. It's the most studied fact in global HIV science. Living positive in 2025 is not about secrecy. It's about self-respect and partnership. American culture values clear boundaries, open talk, and mutual testing. You don't have to carry guilt or hide behind silence. You just need to follow up, take your medication, and keep communication honest. If you're already in treatment, you're not broken. You're protected and capable. And if you're still wondering, remember, testing and treatment are acts of courage, not confession. Live informed, live connected, live forward. That's what the new UU generation stands for. First, thank you for staying with me to this point. Your focus and courage matter. As promised at the beginning, here is the tool that separates imagined danger from real risk in 60 seconds. Step 1. C. Review the 10 signs and your most recent potential exposure with honesty. Write it down. Step 2. Sense. Watch your body for next 24 to 72 hours for fever, enlarged nodes, mouth ulcers, rash, or unusual fatigue. Step 3. Scan. Book tests by timeline, not anxiety. NAT at 10 to 33 days. Antigen, antibody at 3 to 6 weeks. Repeat at 3 months. Rule conclusion. If see and sense produce signals at the window, proceed to scan. If not, document and wait for the window. Now, build 30-day habits that reduce chaos and support recovery. Sleep 7 to 8 hours, moderate alcohol, hydrate, protect skin and mucosa, use lube appropriately, Communicate boundaries and schedule routine screening. Hold this line as your anchor. Peace does not come from guessing. It comes from a calendar and a checklist aligned with science. If this framework fits your life, save it and share it with someone who needs steadiness today. I'm here to keep you informed, calm, and moving forward with control, with calm certainty. You've just learned the 3 pillars that turn anxiety into action: know early, test on time, and live at peace. Early recognition means noticing the 10 signals without catastrophizing, writing them down, and pairing them with honest timelines after any potential exposure. Testing on time is the second pillar. Use the schedule, not your stress. NAT at 10 to 33 days when needed, antigen or antibody at 3 to 6 weeks, and a confirmatory repeat at 3 months if risk was substantive. That is how we separate uncertainty from answer. Living at peace is the third pillar. Modern ART suppresses the virus, UU prevents sexual transmission, and 30-day habits rebuild steadiness. Sleep 7 to 8 hours, moderate alcohol, hydrate, care for skin and mucosa, use lube correctly, and communicate clear boundaries with partners. As your physician, I want to thank you for staying with me to the end. Your story matters, your dignity matters, and nothing in this conversation is about shame. It is about facts, timelines, and choices that keep you and the people you love safe. If this video helped you feel calmer, please subscribe and share it with a friend in the United States who might need clarity today. One click from you can change someone's entire year. And drop a comment telling me which section you want expanded next, so I can build the most useful follow-up. Next time, we'll unpack everyday scenarios that people often misread as exposures, and we'll show how to distinguish imagined danger from real risk. Bring your questions, your calendar, and your courage, because knowledge is how we protect health, relationships, and the future we're all building together. Stay safe, stay curious, and keep testing on time. Your calm plan beats fear every single time. I'm proud of the steadiness you showed.